Hi, Ellen.
Hi, how are you today?
I'm doing okay. I'm glad that you asked. I noticed a few of us here have been complaining about backaches lately.
Oh, okay, yeah. It's very common. Many people are complaining about pain in their back, even in their hips, because of doing so much sitting. I actually have a few suggestions and ideas for stretches around the low back. Would it be okay if I taught some of them to you?
That would sound great.
Okay.
Thank you.
Back pain affects 80% of Americans sometimes in their life, and it's the leading cause of missing days at work, and it significantly limits social activities. And chronic back pain or discomfort that you live with and have to manage all the time, that can lead to psychological distress, including feelings of anger and depression. People with back pain also use a lot more prescription drugs than people without back pain, which can lead to a lot of other health concerns. Now, not all movements and exercises will relieve everyone's back pain. However, we're going to do a few basic ones today that you can do sitting in your chair. Begin in an upright seated posture with your hands resting gently on your thighs. Allow your gaze to soften as you slow your breathing down just a bit. Notice the rise of your belly or chest as you breathe in and the settling down feeling as you breathe out. Maybe breathing in for a count of 2 or 3 and breathing out for a count of 4 or 6. Let's try that for a few rounds, maintaining a soft gaze. Breathing in 2, 3 and out 2, 3, 4, 5, 6. Breathing in 2, 3 and breathing out 2, 3, 4, 5, 6. If you're not already sitting tall, begin to make some adjustments now. Feel that you're sitting with a good base of support, that your spine is erect, and that your neck is positioned as an extension of your spine. Allow your shoulders to settle down a bit, let them come back a little bit, and imagine that your chest is becoming just a bit broader. Now take your hands out in front of you so that all of your fingers are touching and the thumb is spread out. It's as though you're making an L shape with your hands. And place the space between your thumb and your fingers directly on top of your hips, which is actually your pelvis. Your thumbs will be behind you and your fingers will be in front. Together, let's move the pelvis back and forth. You can use the thumbs to tip your pelvis back and the fingers in the front to tip your pelvis forward. On an inhale, bring your pelvis forward, and on an exhale, tip your pelvis back. Repeat that a few times at your own pace. So breathing in and your pelvis comes forward, and breathing out as your pelvis moves back. Clasp your hands together and on an inhale, raise your right knee up towards your chest. Hold on to that front of the knee, and on an exhale, bring your knee even closer to your chest. Stay here for a moment as you move to regain a tall and upright posture, letting your shoulders settle back and down. Now, if you have osteoporosis, stay right where you are and breathe fully in and out for several breaths. If you don't have osteoporosis, inhale with me here, and on the exhale, gently bring your head toward your knee. It doesn't have to touch your knee, but just stay in this position for a complete inhale and exhale. On your next inhale, raise your head up and lower your foot to the floor. Let's do that on the left side. So begin by sitting in an upright posture with your feet firmly planted on the ground, and find that place where your pelvis is right in the middle. Stack your spine and neck over that strong base and clasp your hands together. On an inhale, raise the left knee up and grab a hold of it. And on the exhale, Use your hands to squeeze your knee even closer to your chest. Stay here for a moment as you regain a tall, upright posture, letting your shoulders settle back and down. If you have osteoporosis, stay right here and take a few deep breaths. If you don't have osteoporosis, inhale with me, and on the exhale, gently bring your head toward the knee. Remember, your head doesn't have to touch your knee, but stay here for a complete inhalation and exhalation. And on the next inhale, raise your head up, and on the exhale, let your foot go back to the floor. Sitting upright with your shoulders back and down and your feet firmly planted on the ground, take a full inhale and a complete exhale. Place your hands in that L-shaped position as you've done before, with the fingers touching and the thumb out. This time, take your index fingers right into your hip creases. Leave your fingers there as you move your body forward, hinging at your hips. Bring your navel and your ribs towards your thighs without rounding your spine. Stay here as you position your neck so that it's an extension of your spine and that you're looking down at the floor about 6 inches in front of your toes. Inhale here and feel your ribs or your belly increase the pressure against your thighs. And on the exhale, feel a little bit settling down. On the next inhale, come on up into a seated position. And exhale, hands are on your lap. Once again, sit up straight with the pelvis in the middle, shoulders back and down, feet planted on the floor. Place your hands so that you're holding onto the front of the chair and straighten your right knee out forward. Some of you may want to scoot to the edge of your chair a little bit so that you can feel that the heel is firmly rooted into the floor. Inhale here, and on an exhale, hinge forward at that hip as you hold onto the chair and bring your navel near your thigh as you extend your neck and look down at that foot. Inhale for one breath. Exhale, see if you can go down a little bit more. On your next inhale, come on up. Exhale, bring your foot back to meet the other. We'll do that on the other side. So reset yourself first, feet firmly planted on the ground, sitting on the chair where it's comfortable for you, and hold on to the front of the chair. Straighten out your left knee. Heel is firmly planted into the ground. Inhale here, and on the exhale, hinge at your hips as you bring your navel towards your thigh. Look down at your foot. Inhale fully here, and exhale, see if you can go just a little bit lower. On your next inhale, come on up, and on the exhale, bring your left foot in to meet your right. The last movement is to improve the length of a few muscles around the hip that can be linked to back pain. Let's begin as we always do. Sitting in an upright posture with that pelvis in the middle, shoulders are back and down, and the feet are firmly planted on the ground. Lift the right knee up to your chest, using your hands if you want, and try to place your right ankle on top of your left thigh. Some of you may be able to position the leg so that it forms a triangle or a figure 4. Others of you may need to place the ankle on top of the knee or below the knee. Any place is fine, but hold on to that ankle wherever it is with your left hand, and place your right hand on the inner right thigh, just above the knee. Let's inhale together, and on the exhale, gently push the right thigh towards the floor. Do 2 rounds of breath right here, right exactly where you are. Breathing in and breathing out. Breathing in and breathing out. Wherever your ankle is right now, hold it there. Breathe in one more time, and on the exhale, push that right thigh down a little bit deeper. Inhale, bring your knee up towards your chest, and exhale, lower it down. Let's go ahead and do that on the other side. So inhale, lift your left knee up, grab a hold of that ankle, and place it on your thigh. You're back to a figure 4 position on the left side. If it's comfortable for your leg to be here, that's fine. If you need to have it either on top of your knee or below the knee, that's okay too. Just hold onto that left ankle with your right hand and resume your upright sitting posture as best you can. Take your left hand, place it on the inside of your left thigh, just above the knee. Inhale here, and on the exhale, push that thigh down just a little bit more. Inhale again, and on the exhale, try to move that thigh a little bit further down. One last time, inhale here, and push that thigh a little bit further down. Great. Wherever you are, take an inhale, bring your knee up towards your chest, and on an exhale, lower it down. Let's finish as we started with the pelvis in the middle, shoulders back and down, and feet on the floor. Let's complete one final breath. Inhaling, 2, 3, 4, and exhaling, 2, 3, 4. Thank you for joining me. I hope you'll find the time to take care of your back and break up the day with 1, 2, or all of these movements. So tell me, how did things go with those stretches?
I think it went great. It's amazing how those little stretches improve the way that I feel.
Oh, I'm so happy to hear that. I hope that you would consider breaking up your day every so often to do a couple of those stretches, because that will help you not get so stiff and also make it so that you have less pain as you're going through your workday.
Yes, that would be great. Thank you.